You're connected with Content Delaware.
I'm speaking with Dr. Heather Rooks, chiropractor and integrative health specialist. What is chiropractic medicine?
Well, the first thing I just want to say is that the terminology of chiropractic medicine is a bit of an oxymoronic phrase because what we don't do in chiropractic is use medications to change your body. What we actually do is we assess the nerve system through an analysis of the skeletal system, because the nerves are the electrical wiring of your body, and the job of the nerve system is to control and coordinate the function of everything. The actual spine, the skull, and the spine that protects that delicate nerve tissue is like the switchboard, like an old telephone operator. So what it is that I do as a chiropractor is locate and detect any areas in the body where you've actually got an interference happening in your nerve tissue via skeletal structure. All right, so you've got stress, accidents and injuries, falls, even the birth process can create these misalignments within the spinal column that can actually compress the nerve tissue, creating inflammation, which then doesn't allow the brain to communicate through that delicate nerve tissue or electrical wire to wherever it's going, which is everywhere in the body.
So then an adjustment, in essence, opens up those pathways.
Right.
So that everything can communicate
Exactly.
better.
The terminology medically for what it is that we actually treat as chiropractors is called a vertebral subluxation complex, which means that you've got a bone that's out of alignment in relationship to the one above it or below it. And so our job is to go in and remove that bony interference that's actually compressing nerve tissue, creating muscle imbalance, causing inflammation, and really skeletal breakdown down the road.
So when you move the bone or you shift the bone, it opens up the nerve passage.
Exactly. It just opens up that energy pathway so that your brain, which is your master computer in your body, can run effectively the end organ to wherever it's going, whether it's a piece of skin for sensation or an organ or a muscle, whatever it is. Your lungs breathing, your heart beating, everything's happening under the direction of your nerve system.
So that you're, in essence, healing from within. Your body is healing itself from within by expediting the process of the nerves connecting and all those functions happening, as opposed to treating with a medication or something to suppress a pain or...
Exactly. We're looking actually, when you do chiropractic work, you're looking for more nervous system expression. You're looking for the body's internal healing ability. Our philosophy in chiropractic, we call that the innate intelligence. Within the Chinese system, they may call that the chi or the ki. It's the same energy that's running through the body. And so we're looking to restore that optimally with communication between the brain and the rest of the body so that the brain can regulate the function of everything, send the messages if things need to be repaired, things of that nature, rather than you have this or you have that symptom, let's go ahead and just stop that symptom from happening from an outside perspective, which may be a medication, for instance.
So is that all hands-on discovery for you, or do you have like x-rays and tools like that you use?
Yeah, there's multiple tools. X-ray is a very popular and it's a diagnostic imaging is what we call it, to actually see alignment, degeneration, things like that. MRIs, chiropractors can send for MRIs to see disc involvement, which are the nice little tiny little jelly donuts between the vertebrae. I use some computer scanning technology in my office that allows me to see the function of the autonomic nerve system, which is that wonderful system in your body that's running everything that you don't have to think about, like your eyes blinking, your heart beating. There's so much at our fingertips right now with technology taking off to be able to assess that. But I also am addressing some of the other needs that people need to have met in their life to actually achieve health. And that's above and beyond the spine and the nervous system, but the biochemistry, the endocrine system, which is our glandular system, addressing lifestyle factors, nutrition, and some nutritional deficiencies that I see across the board with people, and really how to manage the aspect of stress in their life. So I kind of integrate that all together with my clients.
So that's all the part that you have control over, or a chiropractor has control with as they're working with a patient. What's the patient's responsibility, and what do you ask your patients to take a look at to take charge of their own health?
As a chiropractor and as a natural health practitioner, 80% of the work is done by the patient. In fact, when someone comes to see me and they call me a healer, I'm like, I am not a healer, I am a mechanic. All right, your body is doing the healing.
Then stress reduction, that's probably one of the hardest things to teach people, and a lot of that is probably, about the exercise and
it is
breathing and all those things.
But if they are getting good spinal care through a chiropractic adjustment, they're going to be actually resetting their system every time so that their threshold for stress is higher. So let's say that someone comes into me and they're in a chronic pain mode. Your brain is getting constantly basically overtaxed from that situation. So what is their ability to handle stress going to be, higher or lower? It's going to be lower, right? So doing that reset on their body and implementing some of these easy lifestyle things is actually going to raise their ability to deal with their stress.
Well, it's been great having you today.
Thanks.
Thank you so much for coming and,
You're welcome.
and for all of your insight and wisdom. I think we all have a lot to learn and about ourselves and our bodies. And, I think every day is a new discovery. For
Great.
me, I know it
Thank you,
certainly is.
Carla.
Thank you.
Yep.